Namaskar, this is Dr. Romila Tiwari, Medical Oncologist, AMRI Hospitals Bhubaneswar. Now, like to speak about the malignancies associated with gynecology, like the women and their reproductive system malignancies, or malignancies called as cancer in the general term. So, how do we detect it early? Early detection of women related cancers related to the reproductive tract. So, any abdominal fullness, पेट बहुत दिन से भारी लग रहा है, कोई कारण नहीं है, you have reduced your appetite, भूख कम लग रही है, more than a week or 10 days, commonly physician will give you some antacids or Digene or something like that. It does not help, and there is heaviness and you feel heavy at your tummy. Please get an ultrasound done. One simple ultrasound will put the light on if something is going wrong within your reproductive tract. Okay, so do not ignore, do not postpone yourself being examined just by a simple gynecologist examination or an ultrasound if you are feeling heavy, uncomfortable at your stomach for more than a week, 10 days or 15 days. Second commonest symptom that the reproductive tract of females, including ovaries, uterus and cervix, shows bleeding. So, apart from the normal menstruation bleed, apart from your monthly regular bleed, if you get any kind of spotting or bleeding which is in between cycles, or a lady who has stopped menstruating, a postmenopausal lady, if she throws symptoms of any bleeding, this is something which is very sensitive. It has to be examined. So, please visit a gynecologist. She will examine you internally and also get an ultrasound done. So, bleeding, okay, is another very important symptom which you should not ignore. The moment you have it, you must know the cause. Hormonal changes, like a female who has stopped menstruating 5-6 months ago and she's having, it can be a part of the natural process of menopause, but we just can't assume. 6 monthly ultrasound, if you are getting an unusual bleeding, interim bleeding, please approach your doctor, please get an internal examination, at the same time an ultrasound done. Pain in your while passing urine, or there is hesitancy, आप ठीक से यूरिन पास नहीं कर पा रहे हैं, आपका यूरिन अटक रहा है, या लॉन्ग सब कुछ ठीक चल रहा था, अचानक से कॉन्स्टिपेशन हो गया, we don't know the reason, why is it? Please get yourself checked. If you are, वैसे these cancers are common in more than like after 30, but then we are seeing patients as young as 20s also. So, do not ignore. My request is to not to ignore symptoms. No doubt these cancers are common in 50 years and above, or for that matter if it is cervix, 40 years and above. But do not ignore your symptoms. Do not tell कि नहीं ऐसा ठीक हो जाएगा kind of, because stage matters. Early stage, cure is very much possible. Probability of cure, I'm talking about a normal life throughout, you lead a normal life throughout your life if it is detected early. So, abdominal fullness or pain which is not getting subsided over weeks, 2 to 3 weeks, any unusual bleeding happening over days, or even if you have bleeding, is something which I would advise you not to ignore even single episode. Yeah, you must get it ruled out. Ki why did you have that bleeding? Whether it was normal hormonal part of your cycles, menopause or whatever, it has to be addressed. And pain, unusual pain while passing urine, or sudden setting in of constipation, and so these things have to be addressed. And believe me, there are screening, prevention to detect the cancer early. Approach your doctor and get yourself checked to catch hold of cancer in early stage, and so that we make the treatment easy. Thank you so much.